ignoring the high social cost of speeding would make legalizing speeding look like a smart idea. Just as many people who speed do not have accidents, many people who smoke marijuana do not have a problem as a result of their use, especially those who use the drug for brief periods of time and/or infrequently. The same is true for drunk driving. It is estimated that the drunk driver's risk of an accident is about 1 in 2,000 episodes of drunk driving. Nevertheless, speeding and drunk driving are punishable by law because of the serious consequences of these behaviors. In all of these cases, legal prohibition serves as a reasonably effective deterrent to the behavior. For those who are undeterred by prohibition, the enforcement of the law produces escalating consequences for repeated violations. Marijuana has many societal costs as well. First, the legalization of marijuana would worsen schools' performance. Assuming that legalization would lead to increased accessibility and consumption, and that marijuana impairs cognition and learning, it is fair to say that legalization will likely damage students' performances in schools. In asking the federal health minister to oppose the legalization of pot, NAPP points out that the many serious ramifications of marijuana legalization have not been adequately studied, particularly the effects that legalization would have on the competitiveness and quality of our schools, colleges, and universities, with students as young as 16 being permitted to smoke marijuana. Marijuana is a drug for life's losers. If we want to produce a better society, there is some room for Big Brother regulations to prevent citizens from doing harm to themselves. This is particularly appropriate in the context of some individuals not having a choice in the matter in the sense they grow up in an environment that exposes them to marijuana and in which they don't have any knowledge of marijuana's costs. The reason that marijuana is and should remain illegal in Illinois is that the drug itself is harmful to the individual and to the community that surrounds it. This is the assessment of the medical and the law enforcement community. Increasingly, this is the assessment of young people as well. Since marijuana use has plummeted by 25% over the past 5 years, young people apparently agree with Australian researchers who recently characterized marijuana based on the comparative studies of youth who used marijuana versus those who did not use marijuana as the drug for life's losers.